you ready to unlock the secrets to managing PCOS-related weight challenges? Have you ever wondered how your daily food choices could hold the key to a healthier, more empowered you? If you're seeking answers, if you're ready to take control of your well-being, then you're in for a treat. Stay tuned until the end of this session, where we'll unravel the intricate relationship between nutrition and PCOS management. Discover the personalized strategies that can lead you towards a path of transformation. Don't miss out on expert insights, practical tips, and a roadmap to a more vibrant life. Your journey to optimal health begins now. Stay with us for the empowering journey ahead. Hey there! Welcome back to my channel. I hope all of you enjoying good health with wealth. Today, I want to share a story with you about one of my patients who came to me with some troubling issues. Let's call her Sarah. I highly recommend staying until the end of the video. It has been carefully crafted with considerable effort, and I believe it will provide valuable and informative content for you and your loved ones. Sarah lived in a small town and had been struggling with severe acne for quite some time. She tried every over-the-counter remedy, but nothing seemed to work. Frustrated and losing hope, she decided to pay a visit to my clinic. Sarah expressed her concerns about her acne and how it was affecting her confidence. I began by examining her skin and discussing her lifestyle, diet, and daily routine. After a comprehensive evaluation, I proposed a treatment plan tailored to Sarah's specific condition. We started with a combination of topical treatments, oral medications, and ongoing skincare routines. Over the next few months, Sarah's skin started to improve significantly. Her acne was slowly fading, and her confidence was gradually returning. However, during her follow-up visits, Sarah started mentioning other troubling symptoms. "Doctor, I've been noticing excessive hair growth on my face and body. I've also gained weight despite exercising regularly and maintaining a healthy diet. Plus, my periods have become irregular and painful." Sarah's new symptoms were concerning, and it seemed to be related to hormonal imbalances. I discussed the possibility of a condition called hirsutism and recommended further investigations. The tests confirmed that Sarah was indeed dealing with hirsutism, weight gain, and irregular periods due to a hormonal disorder called Polycystic Ovary Syndrome, or PCOS. It explained the interconnected issues she had been facing. PCOS is a common condition that affects many women worldwide. It is often characterized by hormonal imbalances, increased androgen levels, and the formation of small, fluid-filled cysts on the ovaries. In Sarah's case, the hormonal imbalances were triggering both her acne and the other symptoms she was facing. PCOS required a holistic approach to ensure proper management. She has too many questions in her mind. She was worried that might be a serious condition. What is Polycystic Ovarian Syndrome? Polycystic Ovary Syndrome, PCOS, is a hormonal imbalance that occurs when your ovaries, the organ that produces and releases eggs, create excess hormones. If you have PCOS, your ovaries produce unusually high levels of hormones called androgens. This causes your reproductive hormones to become imbalanced. As a result, people with PCOS often have irregular menstrual cycles, missed periods, and unpredictable ovulation. Small follicle cysts, fluid-filled sacs with immature eggs, may be visible on your ovaries on ultrasound due to lack of ovulation, which is called anovulation. However, despite the name polycystic, you don't need to have cysts on your ovaries to have PCOS. The ovarian cysts aren't dangerous or painful. PCOS is one of the most common causes of infertility in women. It can also increase your risk of other health conditions. Your healthcare provider can treat PCOS based on your symptoms and if you wish to become pregnant. What age does PCOS start? Women can get PCOS anytime after puberty. Most people are diagnosed in their 20s or 30s when they're trying to get pregnant. You may have a higher chance of getting PCOS if you have obesity or if other people in your biological family have PCOS. How common is PCOS? PCOS is very common. Up to 15% of women of reproductive age have PCOS. What are the signs of Polycystic Ovary Syndrome, PCOS? The most common signs and symptoms of PCOS include irregular periods. Abnormal menstruation involves missing periods or not having a period at all. It may also involve heavy bleeding during periods. Abnormal hair growth. You may grow excess facial hair or experience heavy hair growth on your arms, chest, and abdomen, hirsutism. This affects up to 70% of people with PCOS. Acne. PCOS can cause acne, especially on your back, chest, and face. This acne may continue past your teenage years and may be difficult to treat. Obesity. Between 40% and 80% of people with PCOS have obesity and have trouble maintaining a weight that's healthy for them. Darkening of the skin. You may get patches of dark skin, especially in the folds of your neck, armpits, groin, between the legs and under your breasts. This is known as acanthosis nigricans. Cysts. Many people with PCOS have ovaries that appear larger or with many follicles, egg sac cysts, on ultrasound. Skin tags. Skin tags are little flaps of extra skin. They're often found in your armpits or on your neck. Thinning hair. People with PCOS may lose patches of hair on their head or start to bald. Infertility. PCOS is the most common cause of infertility in PE. Not ovulating regularly or frequently can result in not being able to conceive. Can I have PCOS but not have any symptoms? Yes, it's possible to have PCOS and not have any symptoms. Many people don't even realize they have the condition until they have trouble getting pregnant or are gaining weight for unknown reasons. It's also possible to have mild PCOS, where the symptoms aren't severe enough for you to notice. What is the main cause of PCOS? The exact cause of PCOS is unknown. There's evidence that genetics play a role. Several other factors, most importantly obesity, also play a role in causing PCOS. Higher levels of male hormones called androgens. High androgen levels prevent your ovaries from releasing eggs, which causes irregular menstrual cycles. Irregular ovulation can also cause small, fluid-filled sacs to develop on your ovaries. High androgen also causes acne and excess hair growth in women. Insulin resistance. An increase in insulin levels causes your ovaries to make and release male hormones, androgens. Increased male hormones suppress ovulation and contribute to other symptoms of PCOS. Insulin helps your body process glucose, sugar, and use it for energy. Insulin resistance means your body doesn't process insulin correctly, leading to high glucose levels in your blood. Not all individuals with insulin resistance have elevated glucose or diabetes, but insulin resistance can lead to diabetes. Having overweight or obesity can also contribute to insulin resistance. An elevated insulin level, even if your blood glucose is normal, can indicate insulin resistance. Low-grade inflammation. People with PCOS tend to have chronic low-grade inflammation. Your healthcare provider can perform blood tests that measure levels of C-reactive protein, CRP, and white blood cells, which can indicate the level of inflammation in your body. Can PCOS cause a miscarriage? Having PCOS may increase your risk for certain pregnancy complications, although most women and people AFAB with PCOS are able to successfully carry a pregnancy. Other complications of PCOS related to pregnancy include increased risk of such as gestational diabetes, preeclampsia, and high blood pressure. Preterm birth, before 37 weeks of pregnancy or C-section delivery due to obesity, diabetes, or high blood pressure. How is Polycystic Ovary Syndrome, PCOS, diagnosed? In most cases, your healthcare provider can diagnose PCOS after an examination and discussing your symptoms. They may order blood tests or perform an ultrasound to help with the diagnosis. Your healthcare provider will talk to you about your symptoms and medical history. Ask about your biological family's medical history. Take your weight and blood pressure. Perform a physical exam, looking specifically for excess facial hair, hair loss, acne, discolored skin and skin tags. Perform a pelvic exam to look for other causes of abnormal bleeding. Order blood tests to check hormone levels and glucose levels. Perform a pelvic ultrasound to look at your ovaries, check the thickness of your uterine lining and look for other causes of abnormal bleeding. What are the 3 symptoms to diagnose PCOS? Typically, healthcare providers diagnose PCOS if you have at least 2 of the 3 symptoms: irregular or missed periods. Some people with PCOS have very heavy bleeding when they do have a period. Signs of excess androgens such as acne or excessive hair growth. Or a blood test confirming high androgen levels. How is polycystic ovary syndrome treated? Your healthcare provider will determine treatment based on your symptoms, medical history and other health conditions, and if you want to get pregnant. Treatments can include medications, lifestyle changes or a combination of both. If you don't plan to become pregnant, treatments include hormonal birth control. Options include birth control pills, patches, shots, a vaginal ring or an intrauterine device, IUD. Hormonal birth control helps to regulate your menstrual cycle. Some forms will also improve acne and help with excess hair growth. Insulin sensitizing medicine, metformin, is a drug used to treat diabetes. It works by helping your body process insulin. Once insulin is under control, some people with PCOS see improvements in their menstrual cycles.